Hi, I'm Emily Woodall. Today I'm going to discuss how monitoring hemoglobin A1C levels can help people with diabetes prevent secondary complications from developing. The Centers for Disease Control has listed diabetes as the major cause of kidney failure, non-traumatic lower limb amputation, and new cases of blindness in the United States. It is also listed as the 7th leading cause of death in Americans and a major cause of heart attack and stroke. Research suggests that people with diabetes should keep their hemoglobin A1C levels less than 7% because high blood glucose levels leads to microvascular and macrovascular complications in the body. High blood glucose levels associated with diabetes causes damage to small blood vessels in the body. This can lead to peripheral neuropathy, which is damage to the nerves from high blood glucose level, retinopathy, which is damage to the small vessels in the eye from high blood glucose, or nephropathy, which is damage to the kidneys and can lead to kidney failure. High glucose levels in the blood also can cause atherosclerotic plaque to form in the arteries. This impedes the blood flow to the major organs and can cause heart attack or stroke to occur. This is considered a macrovascular complication. The hemoglobin A1C test is prescribed for physicians as a blood draw, and it gives a 2 to 3 month average of what the blood sugars are. According to the Mayo Clinic, hemoglobin A1C is the best indicator of how well a person's diabetes is being controlled because it gives an average of 2 to 3 months as opposed to a one-time draw that just gives the glucose level at that one point in time. The American Diabetes Association recommends people with diabetes keep the hemoglobin A1C less than 7% by controlling their blood glucose levels. A 7% hemoglobin A1C translates to between 150 or 154 milligrams per deciliter blood glucose level. I created this graph to represent diabetes control in relation to the hemoglobin A1C and how the American Diabetes Association recommends to keep it less than 7. So as you can see here, the good for the hemoglobin A1C would be 7 or 8. So excellent control is less than 7. So it also shows the milligram per deciliter mean blood glucose represented by each hemoglobin A1C level. So a 7, which would be good, but we'd like to keep it less than 7, is about 150. So the green is excellent, orange is good, and red would be poor. If your hemoglobin A1C level were to be 9 or even higher, that would be considered poor glucose control. So this would be checked by your physician, ordered in a blood draw. The Centers for Disease Control has reported there's a direct correlation between high blood sugars and secondary complications developing. By reducing the hemoglobin A1C, these complications are reduced. For example, every 1% drop in a hemoglobin A1C can be as high as 40% reduction in the instance of microvascular complications developing. In conclusion, people with diabetes should aim to keep their hemoglobin A1C levels less than 7%. This decreases their chance of developing deadly or debilitating complications from the disease. The hemoglobin A1C is a very helpful tool prescribed by physicians to determine how well the diabetes is controlled, and by decreasing the hemoglobin A1C level, this can reverse or prevent the complications from occurring. Are there any questions?
Yeah, dude. What types of things can be done to get control?
The American Diabetes Association recommends that a diet, exercise, and medication plan be set up with one's physician to make a personalized plan to get better control of the diabetes. You should never change your plan without consulting with your physician first.
Isn't it dangerous to have blood sugars too low?
That's a great question. It is very dangerous sometimes to have low blood sugar or hypoglycemia. However, low blood sugars do not cause long-term complications the way that high blood sugars do. Next question.
What are symptoms of high blood sugar and low blood sugar?
Another great question. Low blood sugars, which can be the most dangerous and come on really suddenly. The major symptoms of that are like anxiety or stress, shakiness, dizziness, nervousness, blurred vision, headaches, weakness, fatigue, even like anger or sadness. And symptoms of high blood sugar are usually increased thirst and increased urination, or what you see first. Those should be always confirmed with a finger stick glucose before initiating treatment.